So, Dr. Gebbie, I'm Hugh Tilson still, in case I need to introduce myself after over 30 years of friendship. And I can't believe that we finally have captured you in a room. I mean, you're so busy and overall everywhere for this interview. Thanks for joining this series. This is Profiles in Public Health Leadership. Lord knows you qualify. You have the best profile I know. And a leader in every way I can think of. Kristine Gebbie, thank you so much for joining me at this University of Kentucky Center for Excellence in Public Health Workforce interview, because we're going to focus on your work in public health workforce. Because I think that it's important to draw out the rest of this career, since your brilliance as a public health workforce researcher, in my view, rests on your pragmatism. You have been there, done that, and you're not asking theoretical, so-called, our academic friends will forgive us, academic questions. Now, you are a professor and dean at the moment. Yes. So we'll talk about academia, but the reality is that particularly for public health practice research, for public health services and systems research and workforce research, this pragmatic experience of deploying the workforce had to be priceless.
Oh, absolutely. And trying to figure out how to make the best use of them and beginning to understand what I only fully understood 20 plus years later, which is most public health professionals are interchangeable. Oh. Most of what we do in public health is done by at least 2 or 3 disciplines working effectively. And it isn't so much that you have to have brand X in this slot, but that in your mix you have the kind of thinking done by brand X, brand Y, brand Z, and you plug them into whatever jobs you can afford them in or need them most in. And that is, I think it is systems thinking. But it's also digging under the letters after names to say, what have you learned how to do? What are you capable of doing?
Does the word competencies ring a bell with you?
It has begun to ring a bell with me now. But at the time, I don't think we ever used the word.
We didn't use it at all.
Nobody was talking about competencies at that era.
But the notion was that workforce to us meant finding enough people to do the job in the face of terrible budget crunches.
Yes.
And once you had somebody, deploying them. So when we had a case of hepatitis at the Hungry Horse restaurant in downtown Portland, my best shot was to get the sanitarians the heck out of the field and getting them running a shot clinic.
Exactly.
Gamma globulin.
Yeah.
Because they were willing and able and knew how to spell health.
Yes.
And were great at filling out forms and actually pretty darn organized. So you were state health director in the state of Oregon for how long?
11 years.
11 years, which is a pretty good accomplishment for a field where most state health directors have a tenure in office of 2.5 years.
Yeah, it's a bimodal distribution. There are a few that hang on a long time and a bunch who leave very quickly.
Right.
Went through 3 governors.
You went through 3 governors. That's awfully important as well. That is to say, in public health leadership, one recognizes early that there is no room for partisanship.
No. You work for the body politic.
You work for the body politic writ large.
Writ large. You do have to understand who they have elected to lead. You also have to understand that the body politic sometimes makes stupid decisions about what they want, like Oregon not fluoridating over and over again, but that public health should transcend that, and you have to lay out the options for people and do your best, thinking of timing, thinking of how to explain it, how to speak. Not yelling public health loudly at the public, but speaking to the public in its language about what a public health intervention could do for you.
Another vital element of leadership, which you always have evidenced ever since I've known you, and to me it may be the most important one, is integrity. That is, all of that in the face of never compromising yourself to do something illegal, immoral, or fattening.
No.
I mean, the reality here is...
Well, the fattening part got it.
Fattening part. Should we not talk any more about
sorry,
that? No. The notion here is that this is nonpartisan, it has to be for the body politic, but elected officials are sometimes crooks.
Right. I believe one of the things a leader does, or a person taking any new job, is to understand the dimensions of the job, understand how it fits with what you believe, and know what your personal bottom line is. This is where I go. And probably one of my most there was a bad one. One of my very vivid memories from early in the HIV epidemic was sitting with another now departed dear friend, Larry Foster, who was at that time the state epidemiologist.
One of my dear friends as well, a fellow local health officer while I was at the Conference of Local Health Officers.
And I think a Harvard classmate of Dr. Wright.
He was.
In front of a legislative committee talking about record keeping and the anxieties of the gay community, among others, about if we start asking questions about HIV, who we weren't even calling it then,
Yes.
who stood to lose in this prejudicial world of ours. And Larry and I had talked about this at great length before we appeared in front of the committee. And basically we said, if you or anyone in the state asked us to release these records, we would shred them.
Interesting that you say that.
Knowing
yes.
that if we actually did that, we were both out on our ears somewhere.
Right.
But we had thought through our bottom line and knew that there was a point of our responsibility to protect individuals in pursuit of the public health that could not be crossed.
Right. You know that about that, I think you were already in Oregon. I actually appeared before the bench because they had subpoenaed the STD records from the Multnomah County Health Department. And I didn't want to be in violation of the subpoena, so I brought a manila folder, and I said, Judge, if there is an STD record on this person, it's in this folder, because I would not wish to be in violation of the subpoena, but I urge that you quash the subpoena for all the reasons you're talking about. And they did. Oregon was very enlightened about these privacy issues in those days, or just in the earliest age, July 1981, and you were still health officer in Oregon at that time.
Oh, yeah. Well, I think not because of me, but because of the group of people we worked with and their commitment. Partly led by Larry Foster, we started looking at updating our state public health law, including our EPI law, and our questions about record keeping and control measures and isolation and quarantine overlapping with that same period. And head on the work group that produced what we called the Red Book, which was the summary of our deliberations, the ACLU, the Hospital Association, the Medical Association, the local health officials, this assortment, a couple of ethicists, this assortment of people. And we had set a deadline because we had a legislative committee breathing down our neck. We got this close to an agreement. And I forget, you can't even remember now what the piece was.
It came apart.
Oregon, no, it didn't. Oregon is such a place. I looked around the room and I had sort of been taking the temperature and I said, no, you thought today was the last meeting. We are not done until you solve this little piece. So as far as I'm concerned, we're not going to lock the door, but the committee stands till you solve this. And I will tell the legislature we'll get to them when we can get to them. And we walked out of there probably 2 to 3 weeks later and sat in front of the legislature talking about conditions of public health importance with any details to be solved in rules. Right. And the House committee, this picture of this House committee saying to the head of the Oregon ACLU, do you like this bill?
What are you talking about?
Do you like this bill, Hospital Association? Do you like it?
All
everybody is all saying yes. And they, well then danged if we know what to do with you, so they passed the bill. Right. And that was a feature of the openness of the state and the fact that you could get everybody in a room and really work with them.
So in public health leadership, one of the critical attributes that we teach is strategic partnering. Yeah. And obviously in your systems thinking, you were thinking of the public health workforce as more than just the people who worked in the department.
Oh, absolutely, absolutely. Community-based organizations, all of the health professions. Right. We had, in that particular state, the Clergy Association.
Oh, yeah, the faith community.
The faith community was really, really big.
Health,
yeah, lots
and
of places.
Media.
Media were there with us.
Were they there?
They weren't on that committee, but they were hanging around.
Yeah, Oz Hopkins was still doing the health beat in Portland.
Yes,
when,
she was
when you were
at that time.
And she got it.
Yeah.
And she actually helped me with the HIV, it was pre-HIV, but we handed out condoms in the steam in the gay steam baths, and she actually did an op-ed on our behalf. Yeah. Was much more persuasive than anything I could ever have said.
Yes. We had excellent openness on the part of the editorial boards to hear us. If I had a hot issue, I could call them and say, can I go talk with you, tell you what we're up to. A fellow named Greg Parker, who was at Oregon Public Broadcasting, now works for Clackamas County, by the way.
Does he really? Isn't that fun?
There were a lot of people we could work with.